Hi everyone, Dr. Emmy from Pain Free and Fit. Today, for those of you with degenerative disc disease in the lower back, we're going to be talking about a great way to decompress your discs using hanging spinal mobilizations. Hope you enjoy. So one of the things inherent to all cases of degenerative disc disease is there's a degree of compression, vertical compression on the spine. And what happens is as the disc is herniated, because it can't heal, for it lacks deep blood supply, so only the peripheral fibers can heal, there's going to be a dehydration process over time where the disc loses its height as water escapes and the disc starts to come down. As that happens, the two vertebrae that the discs separate come and compress, the joints become compressed together, many times pinching synovial linings and irritating soft tissues causing pain. So today we're going to go over a great exercise that you can do at home as a self-treatment to mobilize or start decompressing that disc. Remember, because the disc doesn't have deep blood supply, it relies on motion to allow nutrients to go in and out of it. So for the health of the disc, this process of what's known as imbibition can be assisted by a hanging mobilization. So let's go over that, take a close-up view, and learn exactly just how to do that.
So to create a vacuum phenomena in the disc, we're going to use a dip station where we can hold on to dip bars to elevate our bodies up. Now, it's not important that your feet actually leave the ground so you're totally suspended. You can do this simply by raising the heels and pushing down on the dip bar so you feel as if your pelvis and legs are hanging away from your shoulders. This can also be done on a kitchen counter where you're leaning your hands on the counter up to the front and using the same thing, pushing up with the upper body as the lower body hangs down. You want to use an amount of push and of drop of the pelvis that's comfortable to you. None of this should be painful. It should actually feel good as you decompress the disc. There are three basic motions that we want to use when mobilizing the spine for degenerative and herniated and bulging discs, which are going to help to imbibe fluid in and out of the disc, support healing, and reduce disc compression, and many times offer pain relief. The first motion is a front to back motion where we're going to anterior pelvic tilt by dropping the pubic bone and raising the tailbone. We'll hold that mobilization for a few seconds and then reverse the direction, tail under, pubic bone up. As I do that, I'm going to use a range of motion that's comfortable, not painful, and I'm going to keep in mind any stability or postural findings and corrections that's needed for my particular spine. If, for instance, I have an anterior pelvic tilt posture where my tailbone is usually higher than my pubic bone, and pain relief is associated with posterior pelvic tilting, I want to emphasize that motion by using a greater range of posterior pelvic tilting, perhaps a 1/4 to a 1-inch motion, and a very small amount of anterior pelvic tilting, perhaps only 1/8 inch. The second motion we'll focus on is a lateral or sideways motion, where we'll be dropping one hip lower than the other, holding for a second or two, and alternating back and forth. Now again, you'll want to target this for your unique needs. If you have a tendency to hip hike with your posture due to either scoliosis, or perhaps you have a tendency to walk or stand with one leg turned out more than another, that side of the hip is usually moving upwards in your normal postures and movements. So you'll want to, when doing this decompressive mobilization exercise, emphasize the opposite motion. That hip a little lower than the other hip when you alternate back and forth. Again, into the corrected direction, you'll move from 1/4 inch to 1 inch, and into the normal dysfunctional posture or alignment, you'll only move perhaps 1/8 of an inch. And the third direction of motion you should focus on is a rotational or twisting motion. Now, when doing this, it's important that we want to separate the torso from the pelvis. So when we turn, we don't want the entire chest and pelvis to turn as one unit. We want the chest and torso to stay straight as we rotate the pelvis. Now, keep in mind your individual corrections that are needed due to scoliosis, or let's say an external or internal oblique asymmetry. You've noticed that you can turn one way easier than another. And particularly if this other direction affords pain relief in your back, you'll want to emphasize that direction. For instance, if I have a right external hip rotation tendency, I stand and walk with that right hip out. The pelvis in relation to the leg has turned to the left. So I'll want to turn my pelvis to the right side. If I have an abdominal oblique asymmetry, where my obliques have set my pelvis to the left, meaning that my left external oblique is stronger than my right, and my internal oblique opposite, I want to emphasize, again, turning to the right. So as I'm either with heels up for a slight distraction or legs totally off the ground, I want to emphasize more range of motion in that direction, 1/4 to 1 inch, versus 1/8 of an inch into my normal dysfunctional position.
If you've enjoyed this video on hanging decompressive mobilizations for degenerative disc disease, feel free to subscribe to the channel. We've got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great way to figure out what your body mechanics are, your muscle imbalances, posture and movement errors, your spinal stability issues, and how they're contributing to your lower back pain, check out our Fast Track program for degenerative disc disease at painfreeandfit.com. It's applicable not only to degenerative discs, but bulging and herniated discs. They're all part of the same cycle, and it'll teach you step by step how to change and correct your body mechanics and build a rehabilitative program to get you back into being physically fit without hurting yourself. I hope you've enjoyed this video on hanging decompressive mobilizations for degenerative and herniated discs.